When I first found out that I had sickle cell, I was devastated. I realized, I couldn't do what everyone else does.
As a mom, you feel like what would their journey would be. So you have a sense of fear because you don't want your children to suffer.
It was just very hard to swallow because we did genetic counseling prior to getting pregnant because we both carried a trait.
So Kevin was first diagnosed with sickle cell disease at about 4 months. I was devastated. I knew that I had a trait, and so did my other son, but that's all that we knew.
And because I live with sickle cell disease myself, it made me feel very vulnerable because a lot of people didn't understand the disease and what living with sickle cell meant.
I had a lot of pain crises, like in my back and then my leg. That's where mostly I have my pain crisis. My energy level was low. I was sick a lot.
It's tough, I think, for any parent to, have to see their child have to go through pain and suffering, especially I think at this age where she can't necessarily express what's hurting.
Kevin probably had to be in the hospital about 5 times.
As time progressed, crises were becoming more frequent, and we couldn't get a grip on what's really going on. It began to interfere with life, things that they wanted to enjoy. It was starting to interfere with their spirit.
Sickle cell disease is a disease of red blood cells. It's an inherited problem. People get it when their parents each have sickle cell trait. When somebody has sickle cell disease, their red blood cells become rigid and misshapen, and they can't travel through blood vessels very well. Patients experience complications like having severe pain that requires hospitalization for intravenous pain medicines, as well as other problems such as strokes, severe anemia, need for blood transfusions, and infections. Hydroxyurea is a medication that people with sickle cell disease can take to prevent a lot of the bad clinical events that they can experience from their disease. Hydroxyurea works in several ways. One of the most important ones is that it increases the amount of fetal hemoglobin in the red blood cells. This helps the red blood cells to keep their normal round shape as opposed to taking on the sickle shape that causes the obstruction of the blood vessels. And as a result, the patients don't have as much pain or as much need for hospitalization or for blood transfusions. In the past, we treated sickle cell disease only when people had severe problems and frequent hospitalizations and a lot of pain. And now, with knowing how beneficial and safe hydroxyurea is, we have moved more towards preventing all of those negative problems of sickle cell disease.
It did take a lot for me to decide to put her on hydroxyurea, but last year in January, she was admitted and I believe was in here for 7 days. And we kind of had a scare. I think that was the longest she's ever been, and so I kind of felt like it's worth a try.
She really didn't have many pain crises, but pain crises are not good, so if we can reduce those to as many as 0, I thought it was beneficial. So I say let's go for it.
And I think another thing that was important was just the doctors and kind of helping to dispel some myths about how it's used for sickle cell patients, helping us to understand how it will relate to our child.
For my children, they were in pain quite a bit and they were suffering. And so because they were aching and experiencing a lot of pain crises more frequently, I had a conversation with their hematologist. And so he went back and gave me the different various of reasons why we should start the drug. The hesitations, the uncertainty went away. I put my fears and everything to the side. And once they were on the drug, it changed everything.
I really feel like it's worth it to take the hydroxyurea because I feel like a major change and my health is better. My energy level, I noticed my attendance at school has been perfect.
I don't miss a lot of school days, and I'm able to get caught up on work. And when I do miss school days, it's only for like a day or two.
Kevin is more active. He's less sick. We don't have as many hospital visits as we did before. And he just seems to be a happier, healthier kid because of the hydroxyurea.
I just, recommend to just give it a try. Just because I know, they're on their basic medications to kind of maintain them, but this has been life-changing for Chloe. She hasn't been admitted in a year now.
She's like very active now, so she's like a normal kid, I would say.
Life after hydroxyurea for Hakeem and Hanaya has been successful. It has allowed them to enjoy things they couldn't before. The children that I used to know with joy and laughter and being goofy around the house, those things start to come back.
As far as side effects, no. I've heard, side effects as far as hair loss. I don't think she's experienced anything that, I thought would have actually kept me from actually putting her on it.
I have experienced a side effect from hydroxyurea. I had hair loss. The hair loss, it was for a short period of time. It lasted about 3 weeks. And it was worth it because it improved my health.
For teenagers who are thinking about taking hydroxyurea and they think of the side effects, it's a give and take. If something is important and it helps you live longer, I believe you should go for it.
I guess my position was, let's just get in front of things instead of, react to something being bad and then want to address it. And it was a decision we made together with talking with our doctor and understanding the pros and cons and doing a little bit of research out on our own. It could potentially preserve her organs. The fact that it's been used with sickle cell patients for, I believe, 20 plus years, that was helpful for me.
The doctor said, it's been a lot of positive feedback. So we said, let's be more proactive so that we can, mitigate some of the issues we'll see later on.
Hydroxyurea has been studied in people with sickle cell disease for over 30 years, including adults and children. It has been found to be safe in all of these age groups and also to prevent all of the severe complications of sickle cell disease, including pain and acute chest syndrome and need for hospitalization. In addition, it is also known that hydroxyurea extends life in adults with sickle cell. The greatest benefit is in people who take it for many years continuously. It is now recommended that all people with hemoglobin SS disease, or the most severe type of sickle cell, or hemoglobin S beta 0 thalassemia, should take hydroxyurea starting at about a year of age. At Children's Hospital now, we have over 100 children taking hydroxyurea. And over the past several years, as the number of people taking hydroxyurea has gone up, we've had a significant drop in the number of people who are hospitalized for pain and fever and acute chest syndrome.
As far as getting Chloe to take it, she's actually, with her being on medication pretty much since she was a baby. I think she's used to it. It's pretty much when we get home, that's what we do. It's just, I pretty much have everything kind of mapped out.
Sometimes she'll remind you, it's time to take it. So I think she enjoys it. It's not hard giving it to her at all.
It's important to take it because if you don't, you will be back where you started from. So I realized as I got older, I have to put reminders in my phone, to make sure I take it every day.
We have a process of, we give Kevin the hydroxyurea as soon as he wakes up in the morning.
For her, it's just a routine, and we make it fun. So, we'll count the medication. She'll hand it to me.
It's very minor adjustment to your regular existence. It's almost like brushing your teeth. It's just what you do.
Prior to hydroxyurea, we had a lot of sickle cell patients constantly being admitted. Since hydroxyurea has been on board, the majority of our patients do not come in as an inpatient having sickle cell pain. Hydroxyurea is just not for pain. It helps preserve the sickle cell patient's organs, like their heart, lungs, and it also gives them a better quality of life.
You're thinking about all these things that come against you with this medicine. but sometimes not making that decision to take the medication is a bigger risk because your body only can take so much. And with sickle cell disease, it is stress on your body. And so if you have something to come along and help your body out, that's a blessing. That's a God-sent answer to me. So for me, I remember being in fear and having questions and saying, no, not for me. But now I can honestly say that's the best decision I've ever made.